Hello and welcome to the Random Review. I'm your host, Asiata Ubaka. Join me on this journey of discovery. Today, I'm excited to converse with Adin Paso, a seasoned radiographer from Queen's Hospital. What exactly happens behind the scenes of medical imaging? Let's dive into the world of radiography and uncover the fascinating work of radiographers. Before we dive in with our guests, let's quickly cover the basics of radiography. Radiography, also known as medical imaging, uses various technology to produce images of the body's internal structures. Common modalities include magnetic resonance imaging. Magnetic resonance imaging, it uses magnetic field and radio waves to produce detailed images of soft tissues and internal organs. Another thing is computed tomography scans. It involves X-rays, computer technology to produce detailed cross-section images of the body's internal structures. Another thing is ultrasound technology. Ultrasound technology utilizes high-frequency sound waves to produce images of internal organs and tissues. These imaging techniques help diagnose and treat various medical conditions, from broken bones to complex diseases. Now, let's hear from our guest, Adin Pato. Can you introduce yourself and your experience in radiography?
My name is Adin. I would say I am a radiographer technician at Queen's Elizabeth Center Hospital. I was studying at Margoy Health Sciences Leon campus from 2019 to 2023. Then year I graduated at the year of 2023. And I started working at Tenga Francisco Bao Community Hospital at Tenga Doha.
Okay.
And I come here at Queen's Center Hospital on 5th March 2024. And I worked here.
So today we are interested in hearing about your experiences with the radiography course and how you overcame its difficulties. What inspired you to pursue a career in radiography?
I was inspired by my cousin. He was a doctor. He does the clinical medicine. So I feel I should do the medicine.
Okay. Can you explain the different imaging modalities used in radiography and their applications?
In radiography, we have different modalities like CT, computed tomograph, X-rays, which is conventional radiograph, ultrasound scan, and MRI, magnetic resonance imaging. On conventional radiography, it uses the X-rays to come up with the image, or the CT, it uses also the X-rays, but the CT radiography, it produces traces than the X-ray radiograph.
Okay. How do you ensure patient safety during radiographic procedures?
One, we give the patient predapol so that we protect it from radiation.
You're saying radiopol?
Predapol.
So what is it?
Predapol is an apple that has the lead equivalent material.
Okay.
Yeah. In addition to that, we give an apple so that to protect the patient from infections. We down dust the areas so that the infection will not transfer to the patient.
Okay. I heard that there is some misconception about X-ray because a few years ago I met a young woman named Aisha who was diagnosed with a health issue and needed an X-ray to aid diagnosis despite her doctor's reassurance. Aisha was terrified. She had heard rumors about radiation, side effects, and worried that the X-ray can cause cancer and make her infertile. So, what are some common misconceptions about radiography and the radiation exposure?
There's misconceptions about that. If a woman or a female is a radiograph technician, you think that you cannot bear a child since the radiation will harm the ovulation period of that person. But it's not true. We protect the female radiographers by giving them the radio form if there is a suspicion of the pregnancy. So female radiographer is pregnant is not allowed to work in radiograph until he gives a birth.
Okay, I have heard that radiography can also cause cancers.
Yeah,
Is it true?
it's true, but we do minimize the incidence of coming up of cancers by reducing the radiation dose to the patient.
Alright, how has radiograph technology evolved in recent years?
Right?
How has radiography technology evolved in recent years? Maybe it has changed, maybe there's a new model.
Yeah, there is a new model. For example, we have a machine that detects the TB. It writes the report of TB, the patient has a TB or not, or if the patient has a fracture. But in earlier time, we have a machine that when you do the examination, you wait for maybe an hour to process the image. But now, the coming of technology, we do the X-rays within 8 seconds, the image is out.
Okay, that's nice to hear because improved treatment times will not only enhance patient outcomes, but you also need to increase patient satisfaction and the trust in healthcare services. So there's good that there's new model of treating patients in radiography. Can you share a particular interesting or challenging case you have worked on? Any case study? Any story?
To me, in this hospital, I didn't have any case that I have worked in, but at a certain hospital many understand what
Yes.
there is a patient that come on the X-ray department, and I do the ultrasound scan. But I failed to document the results.
Yes.
Because the doctor told me that it's okay, cannot document, it's a review. But at later, the patient comes and complain about the report.
Okay. How do you collaborate with other healthcare professionals to ensure accurate diagnoses and effective treatment plans?
We do cooperate by assessing the patients,
Yes.
through taking the history of the patient and communicating with the other department like the clinicians or the orthopedic, the surgery department. We do communicate so that the patient is supported.
Okay. Before taking a break, let's recap what we have discussed so far. With Adin Paso, the radiographer, we have explored about different imaging modalities used in radiography and their applications. We also discussed about how do they ensure patient safety during radiographic procedures. Another thing that we discussed is some common misconception about radiography and the radiation exposure. We also discussed about how has radiography technology has evolved in recent years and the other different topics. Stay tuned for the second half of our conversation, where we dive into different topics. Our guest Admin Paso will share more insights on different topics. To be honest with you, radiography is a very interesting thing. And hearing more about radiography, it can help to improve your lives. Tune in after the break to find out.